Um, Over the last few years, we have presided over a major catastrophe. This is not an electoral map of the United States, okay? This is how the obesity epidemic has been permeating across the decades in the United States. And of course, we know that right next on the heels of the obesity epidemic, there is type 2 diabetes. And so we have seen this happen before our very eyes. More people died from type 2 diabetes in 2021 than they died from COVID. We are in trouble. And so then the question is, why is that? Because we're also in the midst of one of the largest therapeutic explosions in the treatment of this disease that we have witnessed. For many decades, all we had was metformin, insulin, and sulfonylureas. And as we all know, for the last 20 years, we have 13 different classes of different medications that are used to treat this disease. And yet, despite the very large and complex and very therapeutic armamentarium, this is where we are. So in data analyzed for the last 25 years, we see that the number of people who are at goal in terms of hemoglobin A1C in the United States is only about 50%. 50%. And this is despite, if you look, for example, at the number of people here in the center panel who receive at least across the various years, there's escalation of therapy. In red are the people who receive 3 medications as opposed to 2 or 1. So there's escalation of therapy. Medications are being added on top as we treat these people. And millions of people in one of the most developed countries in the world are still not at goal. And of course, the situation is similar worldwide. So why is this the problem?